So the first thing I would do is definitely commend her for wanting to quit. I think it's a great thing. So it's very hard to have a friend or a coworker diagnosed with something like lung cancer, but hopefully this will be the step or the push that she needs to actually to start her trial of quitting. Um, so there's 5 A's for smoking cessation. Um, Ask about her use. So learn about her cigarette smoking. So the frequency, type, degree of dependence, the history of attempts to quit, and the age started. And we know some of these things. So she, smokes 5 to 12 cigarettes a day, and she's tried quitting before and generally has done cold turkey, and that hasn't really worked for her in the past. So she might not be willing to try that again, but if she isn't, that's fine. We will do gradual. Whatever will help her to quit is fine. Advising her facts about like what smoking does to the body. So let her know the risks of smoking. She already has hypertension. She already has diabetes. She's at a much higher risk for stroke. So smoking doesn't help with that at all. Assessing the readiness stage that she's in. So there's 5 different readiness stages. There's pre-contemplation, there's contemplation, there's preparation, action, and maintenance. And she's kind of in that contemplation preparation stage. And we really, really want to get her to the action stage. She's been through that before, but she just hasn't gotten to the maintenance stage. So whatever we can do to help her get there is great. And she might not know how many resources there are available. There are a ton of resources available, and it's definitely our job to be able to kind of hook her up with those. And that brings us to assistance. So assist her with quitting. So cold turkey actually is more effective, but as I previously mentioned, if she's not willing to do that again, that is totally fine. We can do gradual. Setting a quit date is important. A lot of people say, I didn't know this was going to be my last cigarette. Or, like with starting a diet, a lot of people feel like they're more successful if they say, okay, my diet starts on Monday. And then it's really important also to know what your triggers are, assess what your barriers are. Like social or peer pressure. If you have a lot of friends that smoke, let them know that what you're doing and that you really need their support in this. Don't smoke around you, that kind of thing. Ashtrays, get them out of your house. Get all your cigarettes out of your house for starts. And then withdrawal is a big one too. You're going to go through withdrawal, and it's a really hard time on your body. And it doesn't mean that your body is better off for smoking. It just means that it's a big change for your body, and you will come out the other end. Withdrawal is difficult. A lot of people have a hard time with appetite and weight gain. This isn't a good thing with her because she's diabetic, but it's something that we can manage and control. And it shouldn't be, long lasting. And changes of mood, which also isn't a good thing for her because she has depression, but again, something that we can address and that we can closely monitor her for. And then this also comes with other things like insomnia, irritability, anxiety, restlessness, that kind of thing. So all these, cognitive things that come along with withdrawal that aren't fun. We can use meds to help as well. We can use behavioral therapy to help as well. It actually works best if we use both, so behavioral therapy and meds. There's other things too that you can look at, like yoga and meditation and acupuncture and that kind of thing. Kind of if you use all the resources you have, generally you'll be more successful. So when we look at support, I mentioned behavioral therapy, and generally that is really, really helpful. Individual tends to be more successful than group counseling, but either way, if she'll do group counseling and won't do individual, then great, we'll use it. People are very, very attached to their phones. And that can be a benefit when it comes to quitting smoking because there are a ton of resources available on your phone now when it comes to quitting smoking. There's telephone counseling that's free, and that can be definitely effective. There are even texts now. So the National Cancer Institute created a program, and they will text you a few times a day. And you just need to text them, and then they will start texting you. And again, the more reminders, the more support you have around you, even if it comes from texting, is something that can really help you in your road to quitting. There's apps, there's definitely phone apps, and like I said, people are attached to their phones. There's withdrawal support. There's like Yahoo groups, if people still use Yahoo groups. There's websites. There's support all over the place as far as like on your phone or on your computer. And then lifestyle changes. People definitely need to make lifestyle changes. You can't just stay in your same old routines, because smoking was a big part of your routine. Exercising is a big one, especially to help with the withdrawal symptom of appetite and weight gain. Exercise would also help with her diabetes and her blood pressure too, so that would be a big benefit to her. Yoga is a big one because that can help with stress management, and people generally feel more stressed when they're not smoking. So exercise is a big one. Minnesota doesn't have any restaurants where they allow smoking inside anymore, but I know some states that's not the case. So if you go out to a restaurant, sit in a no smoking zone. That kind of eliminates one of those triggers. And then behavioral distraction. So go walk the dog, do puzzles, do adult coloring books, that kind of thing, yard work. And then other, cognitive distraction, well, I already said yard work and walking the dog and keeping your house clean, things like that. Oral stimulation is a big one too, because you had that oral stimulation with smoking. So gum, and that's part of that nicotine replacement therapy. They have gum available, lozenges, that kind of thing. Or healthy snacks, and that's important too because she's diabetic. And then telling yourself that you can do it. Don't focus too much on the fact that quitting hasn't worked in the past. Tell yourself that, yep, tried it a couple times, but this is the time that I can do it, and this is the time that this is going to work. And then remind yourself constantly, especially when you're going through the withdrawal, that like I have a reason why I started this in the first place. I have a reason why I wanted to quit in the first place. And then keep reminding yourself of that. The end goal is a big thing in quitting, because obviously you're going to not feel great while you're doing it, and you're going to really want to go back to your old routine. And then I already talked about yoga and relaxation techniques, and meditation is a good one, and just finding things that are relaxing to you, because stress is a big part that comes with withdrawal and quitting. As far as medications go, I talked about the nicotine replacement therapy. I talked about gum and lozenges. There's also patches available. And that's one of the first line is the nicotine replacement therapy. There's also Chantix and Wellbutrin. For her, I would think, she has depression, and Wellbutrin is a depression med. I think that would be a good first option for her. Wellbutrin's a little bit less effective than Chantix, but with her history of trying to quit and it not working, Chantix you can only use for a couple months, 2 to 3. Wellbutrin you can use indefinitely, and she's already on an antidepressant. I think that Wellbutrin would be a great option for her. I would obviously ask if she's been on Wellbutrin in the past and if it's worked for her, if she hasn't even tried it, or if she's been on it and she didn't like it. Those are all things to take into consideration. If she hasn't tried it, I think that'd be where I would probably start, if she's agreeable to that. But that's kind of all things that we would talk about. If she wants to quit or try quitting again, cold turkey, that's great. That doesn't mean cold turkey and not using anything. All those other methods, the texts, the support therapy, the behavioral therapy, all of that is available to her, and I would highly suggest she uses. And then arranging. So arranging the follow-up, making sure that she knows that I am a foundation for her. I'm a foundation of support for her. So if she thinks something isn't working, say she tries Wellbutrin, she doesn't like it, great. We can switch to Chantix. We can do, if she tried some of the nicotine replacement, the patches, and she hates it, let's try the gum. Let's try, the lozenge. Let's try something else. Trying one thing and it doesn't work doesn't mean that it's not going to work. And I would be there for her as a huge support, letting her know that she can do this. There's a bunch of different things that we can try. And we can definitely do this together. She's not alone in doing this. And if she has side effects, we can work with those. And there's, a bunch of different tweaks that we can make in order to make this work for her. Yeah, I think that's it.